right, hello everyone. Good morning or good afternoon, depending on where you are. Thank you so much for joining us. We're very excited to have all of you here today for a very exciting discussion on what EMT instructors have been asking for now in emergency care and transportation of the sick and injured, 13th edition. So I did want to mention a couple things before we get started. You will notice that all of your audio has been muted, and that's really just to make sure that we have the best audio experience for everyone and that we minimize distractions. So if you have questions for us, we do want to hear from you. So there's a couple ways you can get in touch with us. We have a chat feature where you can type in any of your feedback. Let us know where you're joining us from and what you do. We do love to hear from you. And if you have questions for our presenter during this call, we will have time at the end for Q&A. So we'll make sure we save time at the end to go over your questions. For those questions, please use the Q&A feature. Put them in the chat. We might miss it. So we want to make sure we see your question. So if you look over your Zoom bar at the bottom of your screen, there's a button that says Q&A. So please open that up and type in your questions there. That way we can hold on to them for the end of our discussion. I did want to introduce our host today, Jamil Sylvia. So I'm going to quickly tell you a short bio on his background. Our speaker today is, again, Jamil Sylvia, the EMS product manager here at Jones and Bartlett Learning Public Safety Group. He is a practicing paramedic with a master's in public administration. And earlier in his career, he was the director of paramedic programs under the Center for Pre-Hospital Care at the David Geffen School of Medicine at UCLA, where he oversaw program management, faculty development, and partnerships. He also developed a comprehensive behavioral health curriculum, which he presented at the 2025 EMS World Expo. With prior leadership and instructional roles at Brown University EMS, Transformative Healthcare, and the Warren Fire Rescue Department, Jamil brings more than a decade of frontline academic and administrative experience to advancing EMS education and workforce development. So welcome, Jamil. Thank you so much for being here today, and I'll let you take it away.
Thank you so much, Helen, and hello, everyone, and welcome to today's webinar. Good morning, good afternoon, and good evening to you all, no matter where you may be joining us from. I'm really excited to walk you through what EMT instructors have been asking for and how those needs shaped the 13th edition of Emergency Care and Transportation of the Sick and Injured. My name is Jamil Sylvia, and I serve as the EMS Product Manager here at Public Safety Group. I appreciate you all taking the time to join us today, whether you're getting ready for a program update, planning for your next semester, or really just curious about what's new. I'm so glad you're here. I want to extend a special thank you to all of our international friends and partners who are also here with us today. Over the next hour, we will take a close look at the major enhancements in the new edition, the digital resources that support both instructors and students, and the practical strategies you can use when implementing the new materials. I'm looking forward to answering your questions later in the session, but for now, let's jump right in. So here's a quick look at what we'll be covering today. We're going to start with the big question everyone always asks. Why a new edition and why right now? I'm going to walk you through the key drivers and the feedback that we received that shaped these updates. From there, we'll move into the digital package offerings. There are some major enhancements here, both for instructors and for students, that I'm thrilled to show you. We'll then go into the major content changes and updates, and we'll highlight what's new, what's been reorganized, and why those changes and instructional tools, including some of our new simulations, scenarios, and testing features that support today's EMS classrooms. We'll close with some practical implementation strategies to help you transition smoothly into the new edition, whether you're planning ahead for next semester or making changes sooner. And of course, we'll wrap up with a Q&A session so you can get answers to anything I don't get to cover along the way. Throughout this webinar, there will be a series of poll questions that will pop up on your screen at certain parts. We ask that you answer these poll questions open and honestly, which will help us learn more about the ways to enhance our materials. So why did we create a new edition? So first and foremost, this revision is fully aligned with the 2021 National EMS Education Standards. As you know, national EMS requirements continue to evolve, and we want to ensure that students are learning exactly what today's workforce expects. Second, we incorporated the most recent clinical evidence and guidelines. EMS practice is constantly influenced by new research, new equipment, and updated best practices. So it was essential that this edition reflect those developments. And finally, this edition is directly shaped by your feedback from students, instructors, and program directors across the country. You told us what was working, what wasn't, and where students were struggling, and we used that input to drive meaningful improvements throughout this text and the resources. So in short, this edition exists because EMS practice has evolved, education standards have evolved, and your programs have evolved. And at the end of the day, our goal is to give you a resource that truly supports all of that growth. So let's hear some of the most consistent themes we heard from instructors across the country. One of the biggest themes, mental health continues to be a major concern, not just for our patients, but for our first responders and our students. Programs told us repeatedly that wellness, stress, and burnout need to be addressed more directly, and we took that feedback seriously. We also heard that students are struggling more than ever with foundational concepts, things like basic assessment, decision making, and core knowledge retention. Many programs told us that students are having a harder time completing assessments and staying confident in their learning. Related to that, test anxiety and pass rates remain top concerns. Instructors shared that students often know how the material, they know the material, but they struggle under testing conditions, especially when preparing for the National Registry exam. And finally, there's an increased expectation to integrate technology and simulation into EMT education. Instructors emphasize that these tools aren't just nice to have anymore. They're essential for helping students bridge the gap between classroom learning and real street level experience. All of this feedback directly shaped the updates that you'll see throughout the new edition, both in the textbook and in the digital resources. We've made some major improvements to our digital package offerings. One of the biggest overhauls is the revision. In this revision is that the textbook and the digital tools were designed to work together, not as separate resources, but as a unified learning ecosystem. Whether you're teaching in person, hybrid, or fully online, these digital components help you deliver consistent, engaging instruction while supporting students every step of the way. First, we've now included the ebook within our Essentials package. Previously, it was only available in our higher package offerings, but we felt it was critical that if students have access to our paperback textbook, they also gain access to the ebook as well. The digital packages include a wide range of resources for both instructors and students, everything from updated simulation scenarios to assessments, virtual patient cases, virtual ride-alongs, new skills videos, and overall improved instructor support materials. As we move through this webinar, I'll break down several parts of the digital ecosystem in detail so you can see exactly what's included and how these tools can enhance your course. For now, think of this slide as your introduction to the digital side of the 13th edition, the part that kind of brings the content to light and life and helps students develop that hands-on decision-making skills that they will need to succeed in the field. So that brings us to our very first poll question. So before I move on, I'd love to get your input on this question. When evaluating new EMT course materials, which aspect of a revised textbook is the most important to you? Is it the updated clinical content? Is it the digital tools, the assessment support, the scenario-based learning, or is it something else entirely? Your responses to this poll question can help us better understand what matters most to programs right now, and they can help us guide future updates as well. So please take a moment and respond. We'll give you just a few more seconds before we go ahead and continue. So I know you haven't had a chance to see all of the new content that's in this textbook, but we're really interested in knowing what of the existing materials that are out there do you find benefit you the most? What do you look for as the most important when you're looking to adopt new materials or incorporate these new materials into your classroom? All right, those results have been shared. So we thank you for that feedback. It looks like the alignment with the National Registry and education standards is a top priority, as well as the accuracy of clinical and scientific content. So we'll definitely keep those in mind as we continue on. So thank you for your honesty in answering that poll question. So moving on, we're going to dive into one of the most important sections of today's presentation, and something that actually aligns with the majority of you just acknowledged in that poll question: the major content changes and the updates in the 13th edition. So this is where we'll take a closer look at what's new, what's been reorganized, and how that content has been strengthened to better support both instructors and our students. So many educators want to know, is the textbook aligned with the most current guidelines and standards? Well, here's your answer. One of the strengths of the 13th edition is its alignment with the most current national standards and clinical guidelines. The content has been fully updated to reflect the 2021 National EMS Education Standards. That means that everything that students are learning is directly tied to what today's EMS workforce expects, ensuring programs stay modern and compliant. The textbook also aligns with the National Scope of Practice model, which helps clarify exactly what EMTs are trained and authorized to perform at the national level. This ensures that our content is not just educationally sound, but also operationally accurate for real-world practice. We've also reinforced that alignment with the national model of EMS clinical guidelines, which help ensure consistency in patient care, regardless of where the students eventually will work. And finally, this edition incorporates the 2025 ILCOR and AHA ECC guidelines for CPR and first aid. And these represent the most up-to-date evidence-based recommendations in resuscitation and emergency care. So the big takeaway here is that whether you're teaching airway, medical emergencies, trauma, or the fundamentals, the material in this edition is fully aligned with the latest standards and clinical guidance your students will be expected to follow in the field. In the 13th edition, you'll notice a simple but important update: the shift from the term provider to the term clinician. This change reflects a broader movement within EMS to emphasize the professional, clinical decision-making role that EMTs play in patient care. The term clinician acknowledges that EMTs are not just performing tasks. They are assessing patients, forming impressions, and making critical decisions that impact outcomes. It also aligns EMS terminology with other healthcare professions where clinician is widely used to describe individuals who provide direct patient care. You'll see this updated language consistently throughout the 13th edition, and we hope it reinforces the professionalism and update in the 13th edition, something that many instructors have been asking for. Historically, pediatric emergencies and geriatric emergencies were covered in separate, standalone chapters. In this edition, that structure has been completely reorganized. Pediatric and geriatric content is now fully integrated throughout every relevant chapter. This is in direct alignment with the 2021 National EMS Education Standards, which asserts that this content must be spread throughout a course and not taught in silo. This means that when students are learning about respiratory issues, trauma care, or cardiac conditions, really any topic, they're seeing how these conditions present differently in children and older adults right in context. It reinforces age-specific considerations exactly where they matter most, rather than isolating them at the end of the book. This approach also aligns with the updates in our EMR 8th edition, which uses the same integrated model. And importantly, our advanced EMT and our paramedic upcoming editions will mirror this approach as well. So no matter what level of EMS education a program is offering, students will see consistent organization and progression across all of our initial education texts. Overall, this change helps students develop a more realistic, patient-centered understanding of how age influences assessment and care, something they will absolutely rely on during clinicals in the field. Here's an example of how special populations is integrated, particularly in Chapter 25, bleeding. You'll notice that there are boxes that outline specific information that is pertinent to both geriatrics and pediatrics. So you'll see these throughout several of the chapters of the book, and this is where you have the opportunity as an educator to highlight these special populations in the context of the content that you're teaching. Another important update is our focus on inclusivity, accuracy, and respectful patient representation. One of the key changes you'll notice is how we address skin coloration in patient assessment. We've updated the language to reinforce the real-world differences in how conditions present across a wide range of skin tones. This is crucial because EMTs work with diverse communities, and students need to be prepared to recognize findings accurately, regardless of the patient's baseline complexion. We've also completed a thorough review of both the artwork and the written language in the text to ensure that it is gender neutral, racially inclusive, and free from any stigmatizing terms. That includes updating how we describe patient conditions, behaviors, and demographics to reflect current best practices in medical communication. So these updates are designed to help students learn in an environment that mirrors the professionalism and respect that's expected in modern EMS. And they help prepare them to provide equitable, high-quality care to every single patient that they encounter. Next, let's talk about a feature that I'm particularly excited about as a paramedic clinician myself, the new ALS Assist boxes. These appear throughout the text. These boxes were added to help EMT students better understand what advanced level clinicians, our advanced EMTs and our paramedic colleagues, may be doing on scene. And more importantly, how an EMT can effectively assist in those situations. In the field, teamwork is everything, and we all know that. EMTs frequently work alongside higher level clinicians, and knowing not just the skills within their own scope, but also how to support advanced procedures can dramatically improve patient care and scene efficiency. The ALS Assist boxes, clearly outline what to anticipate, what equipment may be needed, and what supportive actions the EMT can perform safely within their scope of practice. So these additions really help students build confidence in interprofessional teamwork, and they better prepare them for integrated operations in the real world. And this leads us to our second poll question. Here, we would like to know, how soon are you considering updating or switching your EMT textbook or curriculum resources? This helps us understand where programs are in their planning cycle. Some of you may already be preparing for an upcoming semester, while others are still evaluating options for longer-term transitions. Your responses give us a valuable insight into how we can better support your timing, whether that means providing transition resources, faculty training, or sample materials. So go ahead and take a moment to respond, and once those results come in, we'll continue on with the rest of our updates. So give me just a few more seconds here to respond before we share our poll results. So 73% of you believe that within the next 6 months, you'll be considering updating or switching your EMT textbook or curriculum resources, which is incredible to hear because we want our educators to be using the most up-to-date resources available. And this is what the 13th edition is providing. So thank you for sharing that with us today. So now let's get into some of the more specific enhancements to our chapters. And this is one that I am incredibly excited to share. Over the next few slides, I'm going to highlight a few, but every single chapter in the text has received a facelift and proper standards aligned updates. So starting with the beginning of the text is truly a meaningful update. One of the biggest additions here in chapter 1 is the expanded discussion of Freedom House Ambulance Service, which played a pivotal role in shaping modern EMS. Many newer students have never heard of the story, yet it represents one of the most important chapters in EMS history. Freedom House EMTs in Pittsburgh back in the 1960s and 70s were among the first to receive advanced medical training and operate in a system that truly resembled what we think of as EMS today. Their work laid the foundation for pre-hospital care standards, professional training, and community-focused service. By bringing their story forward in the 13th edition, our goal is to help students understand not only how EMS evolved, but also the social and the cultural context in which it developed. It's an inspiring example of innovation, perseverance, and the impact a small group can have on an entire profession. So now, when students begin chapter 1, they're not just learning definitions and system structures, they're stepping into the origins of EMS through real, powerful history. And I'd like to give a shout out and a huge thank you to Dr. Remley Crow for her authorship of this critically important discussion on our profession's history. More chapter enhancements include updates that address both clinical skills and the human side of EMS. First, in Chapter 2, we included significant expansions around responder wellness and professional behavior. We've strengthened discussions on compassion fatigue, PTSD, and the elevated risk of suicide among responders, critical topics that many instructors have asked us to address more openly and thoroughly. We also expanded coverage of cultural diversity in the workplace, as well as cultural humility and competence, helping students better understand how to provide respectful, patient-centered care across different backgrounds. Finally, we added new material on workplace inclusivity and civility, which helps prepare students for the realities of team dynamics and the importance of fostering a respectful and supportive work environment. Second, Chapter 8 underwent a major reorganization to improve its flow and make the material easier for students to follow. We've also updated the photos in this chapter to more clearly demonstrate proper lifting and carrying techniques. This includes the addition of newer, safer approaches like the binder lift and the slip mover, tools and methods many of your agencies may already be using in the field. These updates reinforce safe body mechanics and reduce the risk of provider injury, which is especially important for the new EMTs entering a physically demanding profession. So together, these updates help build students who are not only clinically capable, but also emotionally resilient, culturally aware, and ready to function as professional members of the EMS team. Moving on to Chapter 10. The Chapter 10 includes updated criteria for spinal motion restriction, or SMR, and provides expanded content on respiratory assessment, dyspnea, investigating the chief complaint, and pediatric weight estimation. We know some of these are extremely challenging for students. These updates can help students approach assessment more systematically and make better decisions in both medical and trauma situations. In Chapter 11, we've clarified the distinctions between three important respiratory terms: respiratory distress, respiratory failure, and respiratory arrest. These terms are frequently confused by students, but they're critical for accurate assessment and for determining the urgency of the interventions that need to follow. The updated explanations and examples give students a much clearer clinical picture so they can recognize these conditions early and act quickly. We've also strengthened the emphasis on end-tidal CO2 monitoring, which is becoming more common in EMS systems across the country. This reinforces its value not just for airway management at the advanced level, but also for assessing perfusion, ventilation, and even a patient who's deteriorating. Another important update in this chapter is the new discussion of bougies and the EMT's assistive role in the SALAD technique for intubation. So while EMTs aren't performing these advanced procedures, understanding how they work and how to support them on scene helps improve function, team function, and patient outcomes. We also addressed a key concern in current EMS research: the limitations of pulse oximetry in dark-skinned patients. Students need to understand that oxygen saturation readings may be less accurate in certain populations, and that clinical assessment must always take precedence. All of these changes are designed to strengthen clinical reasoning, reduce some common student misconceptions, and also align EMS education with modern best practices. Now let's look at the updates which focus on two major areas: behavioral health and respiratory medical conditions. In Chapter 16, which covers respiratory conditions, we expanded and updated discussions on pneumonia, COVID-19, and asthma to reflect the most current clinical understanding. These conditions continue to be a significant contributor to EMS call volume, so it's critical that students have accurate and up-to-date information. We also added new content on specimen collection using nasal swabs. This also reflects current practices that many EMS agencies adopted in recent years and helps students become familiar with procedures they may be asked to support during community health deployments or emerging public health needs. Over in Chapter 23, this chapter received a significant expansion to its discussion of mental illness and behavioral emergencies. One of the most important improvements is the clear distinction between what constitutes a behavioral emergency versus an underlying mental illness. Students often struggle with this differentiation, and it's essential for both safety and appropriate patient care. The chapter now includes extensively revised content on acute psychosis, schizophrenia, delirium, and dementia. These revisions help students understand not only the clinical presentations they may encounter, but also how to approach these patients with empathy, safety, and professionalism. Given the increase in behavioral health related 911 calls across many EMS systems, this expanding content prepares students for what they are truly likely to see in the field. Our last slide on chapter enhancements, we're looking at several improvements of certain topics that EMS providers are encountering with increasing frequency in the field. Chapter 28 now includes expanding content on intracranial pressure, as well as intracranial hemorrhage types, including subdural and intracerebral hematomas. These updates improve students' understanding of neurological emergencies and reinforce clinical recognition skills. The chapter also clarifies current practices around spinal motion restriction, including updated guidance on when backboards and cervical collars should be used. Chapter 35 now includes a brand new discussion on human trafficking written by Dr. David Tan, something that states are now requiring be part of initial EMS education curriculum. This is an area where EMTs may have rare but critical encounters, and students need to understand the potential red flags and the appropriate actions to take. The updated content helps them recognize subtle indicators and respond safely and appropriately while remaining within scope. The chapter also includes strengthened content on caring for bariatric patients, which continues to be a significant operational and clinical consideration for EMS. Students will now have clear guidance on safe lifting, movement, and compassionate care of these patients. Next, we expanded the section on ventricular assist devices, or VADs. These devices are becoming more common in pre-hospital encounters, and EMTs need to know what they are, how they function, and what assessments and interventions are appropriate when caring for patients who rely on them. We also updated discussions on poverty and homelessness, as well as child and elder abuse and neglect. These sections help students better understand vulnerable patient populations and the important role EMTs play in both recognition and reporting. The inclusion of Carter kits sensory bags designed to help calm and support children with autism gives instructors a new way to talk about compassionate patient-centered care. So altogether, these enhancements help ensure students are better prepared for the evolving realities of EMS practice and the diverse populations that they'll serve. Our next section of discussion is a focus on the digital platform and the instructional tools, because this is an area where many of you have been asking for enhancements, and we've delivered in a big way. The 13th edition isn't just content update in the textbook. It's also a comprehensive refresh of the tools you use every day to teach, evaluate, and engage with your students. Throughout the next several slides, I'm going to walk you through the major digital updates, including improvements to instructor resources, student resources, simulation and scenario options, enhanced assessments, and redesigned student tools. Our goal with these updates is simple: to give you, as educators, a more powerful, flexible, and modern digital ecosystem that supports classroom teaching. Whether that's in an in-person class, hybrid programs, or fully online delivery. So as we move forward, think about how these digital elements can integrate into your current workflow as educators and how they can help streamline preparation, improve student engagement, and also save you time as an educator. But before we dive in, let's pause here for another quick poll question to learn more about your program. So the question asks, which digital teaching tools are you currently using in your EMT program? This really helps us understand what's already part of your workflow. Some of you may be using simulation platforms. Others may rely heavily on online assessments, virtual patients, or virtual ride-alongs, or interactive learning tools. And for some of you, this may be an area you're still exploring. So your responses here give us valuable insight into where programs are today and how we can best support you with the new digital resources included in the 13th edition. So we'll give you just a few more seconds to select all the tools that you're currently using. And once the results come in, we'll continue with the next set of digital updates. All right, those results are being shared. It looks like 83% of you are currently using instructor presentation materials. A lot of you are using adaptive online learning for students, looking for assessment and test banks, simulation resources, right? There's a pretty good mix across the board, but artificial intelligence is still on the low end, really hasn't taken off quite yet in our world, but we'll get there. All right, so here's a broad look at what's changing digitally, because the 13th edition includes some of the most extensive digital updates we've ever released. I'll start on the instructor side. First, you'll see new technology enhanced items, or TEIs, added throughout the assessments. These help students build the kind of critical thinking and interaction skills that modern exams increasingly require, particularly the National Registry exam. We've also updated the simulation training support, included refreshed scenarios and expanded guidance to help instructors bring scenario-based teaching into the classroom more effectively. These resources were designed to take some of the workload off your plate while giving students more opportunities to apply their knowledge. The comprehensive instructor guide has been fully updated as well. It now breaks down each of our packages and explains how to integrate the digital tools seamlessly into your teaching plan. Plus, we've added 9 brand new skills videos and 6 new active learning strategies, giving you ready-to-use content that supports flipped classrooms, lab days, and blended learning environments. On the student side, we've introduced several powerful new tools. One of the biggest is the upcoming AI-powered student mentor, designed to support individualized learning and help students reinforce key concepts outside of class. This exciting feature is being released very soon. We've also added completely new resources focused on responder mental health, something that, again, that's been increasingly important across EMS programs. Test prep has been updated with new content, expanded rationales, and reorganized question formats. The assessments in action have been reformatted to increase interactivity and engagement. We've also updated virtual patient cases and added 6 new virtual ride-alongs, giving students more opportunities to observe, analyze, and apply their skills in realistic scenarios. And finally, we added new clinical judgment scenarios, which incorporate TEIs and sequencing-based decision-making. These are hidden from students by default, giving you as educators control over when and how these clinical judgment scenarios are used. Altogether, these digital enhancements make the 13th edition a much more dynamic and comprehensive learning ecosystem, supporting not only what students need to know, but how they learn best in today's digital environment. So now let's walk through several of these in a bit more detail. Let's focus on one of the areas instructors rely on most heavily. That's exams and assessments. First, we've updated the entire test bank, which now includes approximately 2,500 questions. This ensures that you have a large, diverse set of items to support chapter quizzes, unit exams, and even final assessments. These questions have been revised for clarity, accuracy, and alignment with the 13th edition content. We've also added technology enhanced items, or TEIs, which you see on your screen throughout the bank. These include drag and drop, sequencing, select all that apply, and other interactive formats that require students to think and respond in more dynamic ways, more in line with the skills required on the National Registry exam. Next, test prep has been updated to include new content and significantly expanded rationales. Students now receive clear explanations not only about why an answer is correct, but also why the other options are not. This helps reinforce key concepts and reduces frustration during independent study. Finally, we've added a brand new resource called How to Prepare Students for the National Registry Exam. This guide gives students concrete strategies for studying, managing test anxiety, and preparing for the types of questions and reasoning skills the NREMT requires. It's a valuable tool for improving student confidence and ultimately pass rates. So overall, these updates give both educators and students a more powerful assessment system, one that supports formative learning, rigorous testing, and strong preparation for the National Registry Certification exam. Here's a closer look at the updated simulation training support and scenarios that are included in this edition. One of the biggest enhancements is the refreshed instructor primer, which now breaks down exactly how you can incorporate simulation into your curriculum, whether you're new to simulation or already using it extensively. The goal is to make it easier for instructors to confidently bring these scenarios into the classroom and help students apply their knowledge in a safe, controlled environment. We've also included 13 unique simulation scenarios, each designed to give students hands-on experience without putting a live patient at risk yet. These scenarios cover a wide range of situations your students are likely to encounter in the field. You'll find scenarios focusing on general communication, which helps students practice interacting effectively with patients and partners. We know this is an area that many students struggle with early on. There are also scenarios centered on medical emergencies and trauma emergencies, which give those students an opportunity to work through both assessment and intervention steps in a realistic sequence. We've also added multi-patient calls, which are great for teaching prioritization and resource management and scene organization, skills that are harder to practice in traditional classroom settings. And finally, there are dedicated pediatric and geriatric scenarios, ensuring that your students gain experience with these special populations that require a different level of communication, some different assessment techniques, and decision-making approaches. So these scenarios can be used during a lecture, skills lab, or even as part of a flipped classroom model, and they're all aligned with the updated content of the 13th edition. The goal is to help you build confident and competent EMTs who are ready for real-world calls, not just written exams. A truly helpful and exciting update is to our instructor guide, which has been completely refreshed for the 13th edition. This guide is designed to make your preparation and teaching process smoother and more efficient. It breaks down every package that we offer in all of its components, giving you a clear understanding of what's available to you and how each resource fits into the broader course structure. One of the biggest goals with this revision was to help instructors, whether you're new or experienced, quickly see how the different resources connect. The textbook, the digital tools, the scenarios, the assessments, and the instructional strategies. This updated guide lays all of this out in a clean, easy to follow format that saves time and reduces guesswork. You'll also find practical suggestions for how to integrate these tools seamlessly into the classroom, including ways to incorporate active learning, simulations, skills videos, and assessments into your daily teaching plan. So whether you're building a course from scratch or updating an existing one, the revised instructor guide gives you a clear roadmap to make everything work together effectively. One of the most practical and hands-on additions to this edition is the updated collection of our skills videos. These skills videos are embedded directly within the chapter placards, which means students can access them right away when they need them, whether they're studying before class, preparing for a lab, or reviewing after hands-on practice. We've added 9 new skills videos, and each one focuses on essential EMT psychomotor skills. These include managing airway obstructions in adults and children and infants, how to properly withdraw medication from a vial, establishing intramuscular access, administering naloxone nasal spray, wound packing, tourniquet application, and how to perform CPR and use an AED in all age groups. These videos are designed to help students visualize each step clearly and build confidence before practicing skills in the lab. They also support a scaffolding approach, right? See one, do one. Students watch the video, then they can get hands-on with the equipment right after. So whether you're teaching in a traditional classroom or in a hybrid format or even fully remote, these skills videos make it easier for students to come prepared and for instructors to standardize how these skills are presented and practiced. Arguably one of the most meaningful additions to the 13th edition is the expanded responder mental health resources. Across the country, EMS programs have consistently told us that mental health and wellness must be addressed more proactively in EMT education. So for this edition, we created an entirely new placard dedicated specifically to responder mental health, and it is included in every single package. These resources are designed not only to educate students about the emotional and psychological challenge they may face in the field, but also to normalize conversations around stress, trauma, and burnout and resilience. The placard includes expanded resources for student learning and a brand new behavioral health-based simulation that walks students through realistic scenarios involving stress reactions, emotionally charged calls, and post-incident processing. These simulations help students practice recognizing behavioral cues in themselves and their partners and prepare them to respond in a healthy, professional way. So overall, this new section reinforces a very powerful message. Taking care of patients starts with taking care of ourselves. So by giving instructors structured resources to support these conversations, we're helping build EMT programs to not only be clinically skilled, but mentally strong and better prepared for the realities of this profession. This slide introduces the completely redesigned assessments in action, which many instructors have relied on for years to help students apply what they've learned. In the 13th edition, these activities have been rebuilt from the ground up. They are now presented as interactive case studies activities, which means students aren't just reading a scenario, they're actively participating in it. They move through the case in steps, answering questions and making decisions along the way, much like they would during an actual call. One of the biggest advantages of this update is that each assessment in action is designed as an ungraded practice activity available for every chapter. This gives students a safe space to practice clinical reasoning without the pressure of a formal exam. It also encourages repeated practice, which is essential for building that confidence and improving decision-making skills. This new format also promotes active recall, which is one of the most effective ways to improve long-term retention. Instead of passively reading or listening to a scenario, students must retrieve information, apply it in context, and learn from immediate feedback. For instructors, these updated assessments in action are great tools to use during classroom discussions or during small group activities, or even during pre-class assignments in a flipped classroom model. Students arrive more prepared, more engaged, and more ready to participate in scenario-based learning. Here's an example of one of those assessments in action on your screen. Next, let's take a look at the updated virtual patient cases, a tool that programs may rely on to help students build true patient assessment competence. In the 13th edition, we now offer a series of 13 fully interactive scenarios. These aren't passive videos or simple multiple choice reviews. Students must actively work through each patient encounter step by step, just like they would on a real EMS call. And these cases are designed specifically to evaluate and strengthen the technical skills involved in patient assessment. So students gather information, they evaluate symptoms, they interpret findings, and they make decisions as the scenario unfolds. What makes these cases so valuable is that they push students to think the way an EMT needs to think in the field. What am I seeing? What does it mean? And what should I do next? The scenarios encourage students to slow down, analyze, and apply their knowledge, and not just recall facts. And because they are interactive, students receive immediate feedback and repeat scenarios as needed to build confidence. These patient cases are excellent for classroom assignments, homework, skills lab, or even remediation. They give students a safe and structured environment to practice assessment skills before they face real patients. And they help instructors identify where students may need more support. So overall, these updated cases provide one of the most realistic, student-centered ways to develop strong assessment habits early on in the program. The new virtual ride-alongs are in 13th edition. These have become one of the most popular tools across EMT programs utilizing our Premier package. Instructors have told us time and time again that we needed to update our virtual ride-alongs, and as many were extremely old. In the 13th edition, we've expanded that library to a total of 23 ride-along videos, all showcasing real-life pre-hospital scenarios. These videos allow students to experience the flow of an actual EMS call, from dispatch information to the scene approach to assessment, decision-making, and patient transport without ever leaving the classroom. Even more exciting, we've added 6 brand new videos that cover high-value, high-impact topics that instructors have been requesting. These include situational awareness, which helps students recognize hazards and understand scene safety, The postictal phase, which shows what a patient looks and sounds like after a seizure, something that's kind of hard to teach with still images alone. A scenario involving a cancer patient, introducing students to considerations around chronic illness, palliation, and compassionate communication. Respiratory arrest, giving students an up-close look at rapid recognition and team coordination during a true life-threatening emergency. A high-impact trauma crash, which demonstrates scene management, mechanism of injury assessment, and multi-system trauma and priorities. And lastly, a geriatric trauma fall, which reinforces age-related vulnerabilities and considerations for assessment and spinal motion restrictions. These videos are incredibly useful for sparking discussions, for introducing real-world complexities, and preparing students for clinical rotations or even field internships if your programs offer those. By watching EMTs handle actual calls, students get a much clearer sense of the pacing, decision-making, communication, and the teamwork, things that are all difficult to convey through text alone. Here's a closer look at one of those clinical judgment scenarios that I previously mentioned, which represent one of the most forward-looking additions to the 13th edition. So even though the NREMT isn't currently assessing clinical judgment at the EMT level as its own domain, we know this is the direction EMS education is moving. And many instructors have told us they want to start preparing students now. So instead of waiting, we've built these scenarios directly into the program with this edition, and they are found in every package offering. Each clinical scenario is structured as a series of 5 interconnected questions designed to help students walk through the same kind of reasoning process they need on real calls. These scenarios also incorporate those TEI questions to help students practice prioritizing steps, evaluating information, and making decisions in a logical order. One feature instructors will really appreciate is that these scenarios are hidden from students by default. This means you decide whether to use them as a graded assignment or assessment, ungraded practice, remediation tools, or enrichment activities. As the instructor, you're in complete control over when and how students access them. These scenarios are included in most chapters, giving students repeated, structured opportunities to develop stronger clinical reasoning. The goal is to help them start thinking like clinicians early in their training, build confidence long before they step into the field or take their certification exam. For those utilizing our flipped classroom package, we also have some updates for you. These changes are designed to make it even easier to run an engaging, student-centered course. First, we've completely refreshed the course plan and activities. These updates make the flow of each lesson clearer, more intentional, and more aligned with the 13th edition content. Everything is designed to support active learning, so students are doing more than listening, they're analyzing, practicing, and applying information throughout the lesson. We've updated the assessments included in the flipped classroom model to incorporate the new TEI questions, which also help students interact with the material in more meaningful ways. A major improvement is that pediatric and geriatric content is now integrated throughout this course, just like in the textbook. But to make sure instructors can still dive a little bit deeper when needed, we've also included separate lessons. Finally, the trauma overview lesson has been split into 2 shorter segments. Instructors have told us that previous versions in previous packages that the trauma content was a little too much for students to absorb all at once. So by breaking it into 2 smaller digestible lessons, students can focus better, retain more, and practice applying those concepts more effectively. To learn more about the flipped classroom package and how you could better prepare your students, I urge you to attend our next webinar on April 30th, hosted by none other than Dave Page, the leader in EMS flipped classroom strategies. Before we move into the final implementation strategies, we'd like to hear from you all one last time with a poll question. This poll question asks, what is your biggest challenge when teaching EMT students right now? So every program faces different obstacles. Some are seeing gaps in foundational knowledge. Others are dealing with test anxiety or skill performance issues. And many are navigating staffing shortages and clinical placement limitations or shifts in what students expect from the educational institutions. Your responses help us understand what's happening in classrooms across the country and allow us to tailor our support resources, and future updates to your real day-to-day needs. So go ahead and take a moment and choose the challenge that resonates most with your program. And once the results come in, we'll take a look into how this 13th edition can help address some of these key areas. So student engagement and attendance seems to be leading the charge, followed by differentiating instruction for diverse learners. So let's take a look at the next set of slides, which will go through implementation strategies for educators. So this is where we take everything we've talked about so far, the content updates, the digital enhancements, the new assessments, the instructional tools, and translate them into concrete steps you can use when bringing the 13th edition into your classroom. So our goal here is to make the transition as smooth and manageable as possible. So again, whether you're planning for next semester or doing a phased rollout, these strategies will help you map your existing materials to the new structure, integrate the new digital resources, and make sure your students get the full benefit of all the updates in this edition. So now that we've walked through all the major updates, let's talk about how to transition smoothly into 13E. We've outlined several recommended steps here that can help make your adoption process as straightforward and organized as possible. So recommended implementation steps. The first step, rather than just mapping chapters, is to conduct a curriculum gap and gain analysis, and specifically to intentionally look for new concepts or skills that weren't present in the old edition, removed or condensed content, meaningful enhancements, right? These are the evidence-based practices, the simulations, the mental health content, the TEI questions, right? And you use that analysis to then help you identify what needs to be added to lectures or labs, what can be retired or removed, and what needs a new instructional approach. And these also prevents the concept of carryover teaching, right, from previous editions that no longer align with the updated standards. So we highly suggest you conduct a curriculum gap and gain analysis first. Next, design a transition semester plan. This plan acknowledges that instructors can't overhaul everything at once. We recommend a phased approach that may include starting with replacing must-change elements, right? These are things like clinical guidelines, assessments, scope changes, the pediatric and geriatric integration, right? Those are the must changes. The next phase may be layering in pedagogical improvements like simulations, clinical judgment scenarios, and even some of those TEIs. And the last phase would be to refine and optimize. So how do we reorganize our lecture flow? How do we adopt the new study resources? A deliberate phase in reduces cognitive load for both you as the instructor, but also for your students. You'll also want to make sure that your lesson plans, your slides are updated as appropriate to reflect the changes that we've discussed, especially the integration of the pediatric and geriatric content, the reorganized chapters, and expanded mental health and inclusivity topics. Another helpful step is to run a faculty calibration session, right? Gather your team together, your primary instructors, your adjuncts, your lab personnel, review the major content changes, align how terminology will be used, calibrate assessment expectations, and walk through the revised chapter structures. This ensures consistency across your team, which is especially critical in EMT education where multiple instructors may rotate in and out. By following some of these steps, your transition into 13E will feel more intentional, organized, and manageable for both you and your students. This last slide before we close is offering a set of practical teaching tips, things you can easily incorporate into your course to help students succeed with this newest edition. So first, as an EMS educator myself, I always recommend blending your textbook reading with scenario-based discussions. When students immediately apply what they've read in a real-world situation, their retention and understanding improve dramatically. Even brief 5-minute scenarios, conversations in the classroom can make a difference. Take advantage of the simulation resources that are available. We added and updated a lot of material in this edition because simulation is one of the most effective ways to build clinical judgment, confidence, and communication skills. And you can use full simulation scenarios, the virtual patient cases, or even some quick tabletop simulations depending on your class flow. A great strategy is also incorporating micro-learning modules where you see fit and where it makes sense. Instead of tackling an entire chapter in one sitting, perhaps we need to break content into shorter bursts or mini lessons, if you will, quick demos, short activities. Students tend to stay more engaged and you can reinforce key concepts more frequently. Another highly effective approach is using the new skills videos before lab sessions. This aligns perfectly with the see one, do one approach. And finally, don't forget about the clinical judgment scenarios. Whether you choose to use them as graded assignments or as ungraded practice, they provide an excellent way to assess students' understanding and mastery of the material. These scenarios help reinforce critical thinking and prepare students for the future direction of EMS education. Thank you all so very much for joining us today and spending your time learning about the new EMT 13th edition. Before we jump into some of your questions, I want to take a moment to just recognize the incredible teams here at Public Safety Group from content, production, marketing, and sales, whose dedication and creativity really brought this reimagined textbook and its resources to life. Your hard work truly has made this a one-of-a-kind project. I'd also like to extend my gratitude to our series editor, Dr. Alfonso Mejia from the American Academy of Orthopedics, as well as our lead editors, Dennis Edgerly and Dr. Kim McKenna. And a sincere thank you to our 16 contributors and an impressive group of 66 reviewers who played a vital role in shaping this edition. And finally, a special thanks to everyone who supported the photo shoots. Your effort helped us capture the realism and the professionalism that define this new edition. So thank you all so very much. And I'll leave you with our last slide. If you have any remaining questions, please don't hesitate to contact our team. And now I will turn it over to Helen.
Awesome. Thank you so much, Jamil. And thank you again, everyone.